bird flu. It's kind of freaky, right? It's been everywhere in the news lately. And honestly, it's a little unnerving. Especially, I don't know, when you think about vulnerable people like pregnant women.
Yeah. Yeah. No, it's a valid concern. I mean, we are seeing this H5N1 strain spread like all over the globe. And while we haven't really confirmed, like sustained human-to-human transmission yet, it's definitely something we got to keep an eye on.
Right. And on that note, there's this recent study out of Australia that looked back at data from, past bird flu outbreaks. And it's kind of scary what it says about how this virus can impact pregnant women and their babies.
Yeah. This Australian study, it was published in Emerging Infectious Diseases. It really has a lot for us to think about. The researchers, they reviewed over 1,500 research papers just to find confirmed cases of bird flu, in pregnant women from, those past outbreaks.
Wow. 1,500 papers. That's a lot. But I have a feeling their findings weren't exactly, good news.
No, you're right. They found a 90% mortality rate for pregnant women who got bird flu. And then on top of that, 87% of their babies also died.
Oh my God, that's awful. A 90% mortality rate. It's hard to even imagine.
It is. And the babies that did survive were often premature.
Yeah.
So, pretty severe complications for both the moms and the babies.
Wow. So, I mean, this kind of makes you wonder, why are pregnant women so much more susceptible to this virus? Is it something about the virus, or is it like pregnancy that's making them so vulnerable?
Well, it's actually the changes that happen during pregnancy. Pregnancy it alters the immune system. It's not that the immune system is weaker. It's more like it shifts focus to protect the baby.
Oh.
And unfortunately, that can make it less good at fighting off like other things like viruses.
So it's like their body's dedicating like all its energy to protecting the baby, and that leaves them kind of open to other dangers.
Exactly. And with a virus like H5N1, that can unfortunately have really, really bad consequences.
With pregnant women being so vulnerable to H5N1, it seems like there should be a vaccine, right? To protect them?
Yeah, well, that's where things get kind of complicated. Right now, there aren't any avian influenza vaccines like designed for people, approved for everyone to use. And the ones that are being developed, well, they often don't include pregnant women in the trials.
Yeah, I mean, I get the ethical concerns about including pregnant women in trials, but it seems like it creates this difficult situation, right? How do you balance the need to protect pregnant women with the need to actually get the data to make sure vaccines are safe and effective for them?
Yeah, it's a tough balance, that's for sure. And this study just really highlights how much we need more research, that's focused on pregnant women and how they respond to vaccines.
It feels like we're in a tough spot. We can't ethically just expose pregnant women to these potential risks in trials, but we also need to know how to protect them if things get worse with this virus.
Yeah. And speaking of things getting worse, we've got to look at the bigger picture here. While this study was limited to like 30 cases, and most infections still come from, being in direct contact with poultry, what if sustained human-to-human transmission it happens? What if it becomes a reality?
That's a scary thought. So far, knock on wood, we've managed to avoid that, but we can't ignore that it's possible.
Exactly. This study, even with its limitations, it's like a warning. We've got to be prepared, even for the worst case scenarios.
Especially when you think about the fact that most of the cases in the study were from developing nations, where access to healthcare might be more limited. I imagine that really affects how bad the outcomes are.
Oh, absolutely. Access to healthcare, it plays a huge role. But, I mean, even with that in mind, these findings are still really worrying.
It seems like the U.S. government's taking this threat pretty seriously, though, right? Didn't they just invest what was it, $95 million into avian influenza preparedness?
They did. And it's definitely a step in the right direction. But there are some potential obstacles to think about, especially when it comes to public perception and how people react to these things. Remember all the the division about lockdowns and vaccines with COVID?
Yeah, that's a good point. I mean, it's not just about having the money and the tools to fight a bird flu pandemic. It's also about, are people actually going to use them? Are they going to go along with it?
Exactly. And you see these same anxieties in debates, even if you just scroll through online forums like Reddit, people are talking about it. And it raises the question, are we really prepared? Especially here in the U.S.
You mentioned the government investment, but is $95 million really enough to deal with a potential pandemic, something this big? What exactly is that money going towards? And is it actually being used the right way?
So most of that money, that $95 million, is going towards, new vaccines and antiviral treatments,
Yeah.
better surveillance systems so we can actually keep track of the virus, and making sure we have enough, like, medical supplies stockpiled, the essentials.
Okay, so those are all really important things, but I still can't shake this feeling of unease, especially after reading about that one really bad case in the US.
You mean the one in Louisiana, right?
Yeah, yeah, the one they think came from those backyard chickens.
Right, right. And that's what's so concerning about that case. It didn't come from some big commercial poultry farm, where they have all those strict, biosecurity measures in place. It came from this, like, small backyard flock.
Wait, so someone's like pet chickens?
Yeah, basically. And to make matters worse, the CDC, they've already found H5N1 in another backyard flock in Louisiana.
So it's spreading, like even here in the US.
It seems like it. And this just adds another layer to the whole situation. I mean, how do you control a virus that's, like, going around in these backyard flocks? It's not as easy as just shutting down, like, a big operation. We're talking about maybe thousands of these small flocks all over the country. It's a logistical nightmare trying to contain that.
Yeah, that does sound incredibly difficult.
It's a huge challenge, and it really highlights how important, public education is, and awareness,
Hmm.
right? People need to understand, like, how risky it is to keep poultry, and how to actually protect themselves and their communities.
So it's not just about like waiting for a vaccine or hoping the government will just like take care of it. It comes down to people taking responsibility and being careful.
Exactly.
Yeah.
And that means, if you are going to keep poultry, you got to have those biosecurity measures in place. Don't touch sick or dead birds.
Yeah.
And just stay informed. Like, if there's an outbreak in your area, you got to know about it.
And knowing the symptoms, I bet that's crucial too.
Yeah. Oh, absolutely. Early detection is key. The sooner we can identify those potential cases, the better chance we have to stop it from spreading.
It feels like, what we thought about this virus has changed so much, like so quickly. We went from thinking, okay, bird flu's out there, but it's not really affecting people to like, oh, wow, this could get really bad really fast.
That's the thing with infectious diseases. They're unpredictable. They can kind of simmer for a while, and then all of a sudden, beam, they explode.
And we aren't exactly the best at predicting these outbreaks, are we?
No, we tend to focus on what's happening right now, and we forget that things can change so quickly. That's why this Australian study is so important. It's like a wake-up call. It reminds us that we have to be ready, even for the worst scenarios,
Yeah.
even if they seem really unlikely right now.
And like the study shows, it's pregnant women and their babies who could really suffer the worst consequences.
Exactly. And that actually reminds me of something I saw on that Reddit forum. Someone was joking that, maybe this is the last pandemic we'll have to worry about.
That's well, that's a pretty dark way to look at it, but I get where they're coming from.
It's kind of true in a way. I mean, if you have a virus that's really contagious and has a high mortality rate, if it just spreads, without being checked, it could lead to, fewer people who were susceptible,
Yeah.
tragically.
That's that's heavy. It really makes it all feel a lot more urgent, like we have to figure this out now because we might not get a second chance.
It's a good reminder that we have to learn from our mistakes. We got to pay attention to the warning signs and make preparedness a priority, even when it's, politically inconvenient or expensive.
Because I mean, those challenges are nothing compared to what could happen if we don't do anything.
Exactly. We can't just sit back and be complacent. The stakes are too high.
This whole conversation has really made me think about, how different groups are vulnerable in different ways. We can't just have this one size fits all approach to getting ready for a pandemic.
You're right. Different people have different risks and different needs.
Hmm.
And pregnant women, like this study shows, are some of the most vulnerable. Their immune systems just work differently. And the consequences if they get infected, they're devastating.
And it's not even just the physical health aspect, right? I mean, the emotional and psychological toll on a pregnant woman during a pandemic, it's got to be immense. All that anxiety and fear and uncertainty, it all adds up.
You're absolutely right. We got to make sure our healthcare systems and support networks are ready to deal with all of that too. Pandemic preparedness isn't just about surviving. It's about making sure people can live good lives afterwards. And that means thinking about the whole person, their physical health, their mental health, their social well-being, all of it.
So, I mean, where do we go from here? What can people do to like actually prepare themselves and their communities for, for all this uncertainty?
That's That's the million-dollar question, isn't it? And there are no easy answers. I mean, it starts with, being aware. We got to learn about the risks, stay up to date on what's happening and actually talk about it, have those difficult conversations
Yeah.
about how we get ready for a pandemic.
And maybe speak up for policies that, put public health and science first. It's not just about individual choices. It's about like taking action together and being responsible for each other.
Exactly. We need to expect more from our leaders,
Yeah.
from our healthcare system, and even from ourselves.
I gotta be honest, it all feels kind of overwhelming. Where do you even start with something this big and unpredictable,
Yeah, I get it. It can be really daunting. But I think the key is to focus on what you can control. Start small. Learn as much as you can. Talk to your family and friends about it, even if it's hard. Reach out to your community and see what resources they have.
You're right. Even small things can make a difference. It's about like building that resilience both for yourself and for everyone around you.
That's it.
Yeah.
And remembering we're not alone in this.
Right.
We're all in this together.
I think that's like the biggest takeaway from this whole deep dive. We might be looking at some scary possibilities, but we're facing them together. And if we work together, share what we know and support each other, I think we can get through this and make a safer, healthier future for ourselves and for the next generation.
I like that. And to our listener out there, I want to leave you with this thought. Knowing what we know about how dangerous avian influenza could be and thinking about, what we just went through with COVID, are we really ready to face another one of these global health crises? What did we learn? What else can we do to prepare ourselves, our families, our communities for, whatever might be coming next?
Yeah.
Keep asking these questions, keep looking for answers, and keep talking about it.
Because knowledge is power. And in a world with all these new infectious diseases, that power it's more important than ever. Stay curious, stay informed, and stay well. It really does feel like we all need to work together on this.
Oh, absolutely. And part of that is, recognizing that different groups have different vulnerabilities, like pregnant women.
Because, like we were saying, it's not just about getting through a pandemic, right? It's about making sure everyone can thrive afterwards. And that definitely includes moms to be.
Yeah, that's a really important point. We need to provide support for the whole picture, the physical challenges and the emotional ones, especially for pregnant women.
Okay, so let's get a little more practical. What can our listeners do to prepare, for the threat of bird flu, especially if they're pregnant or thinking about getting pregnant?
That's a great question. First and foremost, talk to your doctor.
Mm.
You know, talk about your concerns, and they can give you advice based on your specific situation.
Okay, so besides talking to your doctor, are there any like practical things people can do?
Well, you know what you always say: knowledge is power. So stay informed, follow reliable sources like the CDC, and don't believe everything you see online, especially those crazy rumors.
So like double check before you share, right?
Exactly. And just simple precautions like washing your hands a lot, don't touch sick birds. These are all things we should be doing anyway, but they're extra important if there's an outbreak.
It sounds like a lot of it boils down to being responsible and making good choices.
Yeah, I think so. We all have a part to play in, protecting ourselves, our families, our communities. And part of that is, pushing for policies that put public health first and listen to the science.
So get involved in your community, talk
Mhm.
about how to prepare for a pandemic and speak up.
Exactly. We can't just sit back and watch. We need to be part of creating a future where, we're more ready for these kinds of challenges.
This has been a really interesting deep dive. We've covered a lot of ground, from the scary stats to things people can actually do. And I think it's clear that this issue needs us to approach it from a lot of different angles.
I agree. It's a complicated problem, no easy answers.
Yeah.
But, understanding the risks, having these conversations, taking those steps to prepare, it can all make a difference.
To our listener out there, I want to leave you with a sense of, that you can do something, not just fear. The future might feel uncertain, but you can make smart choices, take action, and fight for a healthier future. We're all in this together, and we can do this. We have the knowledge, we can be resilient, and we have each other.
Beautifully said. And remember, stay curious, stay informed, and stay well.